Hi, good afternoon. My name is Dr. Ananya Puttaraju. I'm a senior orthopedic consultant working at Hosmat Group of Hospitals, Bangalore. A bit of history about myself. I did my basic medical degree from Davangere, following which I relocated to England. I had a stint of about 15 years in England, where I completed the further surgical training in terms of MRCS, FRCS, and European board exams. I had an opportunity to do fellowship in what we call as a computer-assisted robotic knee replacement, and also on foot and ankle surgery. I have been in orthopedics now for 20 plus years, and this is my brief introduction. I relocated back to Bangalore in 2016, and since then I've been working in private hospitals. Today, the topic that we are going to discuss is about knee arthritis. I'm sure you all would have heard of this condition called arthritis. What is arthritis? It's a wear and tear of the cartilage. Cartilage, if I can say, is like a covering of your bone. If you could imagine a carpet that covers your floor, similarly, there is a cartilage that covers the end of your bone. When we have cartilage covering the bone, so there's no friction between two surfaces. So you have good range of movement. So anywhere there are two bones meeting, let it be a finger, let it be the neck or your knee joint, where two bones come and meet, there is a covering of this with bush called cartilage. And when this cartilage becomes thinned out or worn out, that is called as arthritis. There are various kinds of arthritis. The commonest one being what is called as a primary arthritis. This affects usually the elderly population above 60 years plus. The knees appears to be the commonly affected joints, but as I said before, it can affect any joint from the hip to the neck to the shoulder to any joint. So this is primary. There are other kinds of arthritis as well. So let's say you had an injury, you had a fracture to your bone very close to the joint. So the joint is not in alignment anymore. Then there could be chances of you developing wear and tear in the joint. The other things are called infection. If you have a tuberculosis or some kind of joint infection, then also that can eat away the cartilage of the body, and that can give arthritis. Now, how would you know whether you or your loved ones have this condition? The clinical signs of arthritis, first thing is pain. See, pain in the affected joint. So we'll typically complain of pain around the joint, swelling. There will be some amount of swelling, and there is stiffness. They find it difficulty to go up and down stairs, and there will be some muscle weakness because they don't use the joint so well. And they complain of crepitus, or what is called as this click sound when they're going up and down stairs. So these are the features of arthritis, and depending on which joint is affected, you can get different features. So when you have this arthritis, the initial treatment would of course be in terms of giving simple painkillers like paracetamol, applying a pain gel, and hot fomentation. These are the traditional way where everyone tries to apply these local measures, and in early stages they do well. Okay, it's only when this arthritis, when this cartilage gradually wears off, and when it becomes so worn out that the bone underneath gets exposed, that is when you start having friction, and that is when you start getting more pain. As arthritis continues, you start to notice that the leg starts to bend. You might have noticed people walking in the park where they have a slightly bent knee when they walk with the sidewards gait, because they are putting all the weight on the unaffected side, and even that can become painful. Now, what are the risk factors? Who gets this? Unfortunately, most common arthritis, which is called primary arthritis, we don't know why someone gets it. Like you have seen people who are 90-year-old who are quite comfortable, who are walking quite well, and his son who is in his 50s or 60s are developing the arthritis and difficult to walk. So most common cause of arthritis we don't know. But definitely the lower limbs, what we call as the knee joint, because it's a weight-bearing joint, because your body weight has to go through the knees. Definitely, they're the commonest joints that get affected. And other risk factors, it can, as I said, run in the families. Females appear to be more affected than men. Now, other thing people commonly ask is, do overweight people develop arthritis? There's no evidence to say that obesity or weight causes arthritis, but obviously a person who is overweight will find it difficulty to walk because he's carrying the load. So these are the risk factors. So once you suspect you have got this joint pain, you usually go and meet your general physician and your local doctor, who will take a history from you, will examine your joint, see what is the range of movement, and they will take an X-ray. X-ray is the commonest thing as a first line of investigation that's been taken. When we see the X-ray, what we're trying to look at is the gap between the two joints, where normally bush is covering the two joints. When the bush is thinned out, bone starts rubbing against the bone. That is what we are looking for to see. That's why we take an X-ray. Now, the treatment, as I already told you, we start with simple paracetamol, maybe a crepe bandage. Physiotherapy is also very important, which helps in strengthening the muscles around the knee joint. Basically, there are some quadriceps strengthening exercises which are taught, which should be done at least 5 minutes a day, which help in strengthening and taking the load off your joint. Other thing that works well is also to avoid squatting on the floor, using the Indian toilet, and also using stairs repeatedly, because this will put additional stress on the system. Okay. The other commonest thing that people ask is, should we exercise? Now that we know that we have some arthritis, can we exercise the joint? Actually, it's a myth that just because you have arthritis, you should not do exercise. It's very important you keep yourself physically fit. At 20 minutes of vigorous physical activity of any form, including a speed walking, is very important to keep your muscle tone. And because otherwise what happens, if you don't use them, you lose them. So muscle starts becoming weaker. So these are the initial stages. And once you get to a stage where the pain has reached to a point affecting your quality of life. For example, you have to think twice about going out, even for a hotel or even to a movie theater. You're worried that how am I going to cross that incline? The footpaths, sometimes if they're uneven, you find it very difficult to navigate. So these are the situations where the condition has gone beyond and it's severely affecting your quality of life. And in these instances, that is when we talk about a joint replacement surgery. So joint replacement surgery basically means a cartilage that was worn out will be replaced by a metal cap and a plate, and we put a polyethylene or a rubber in between so that the two ends don't touch each other. Knee replacement surgery is one of the most successful surgery out there. It has been done for the last 30 years. It is one of those surgeries which give the life back to the patient, especially who are severely affected in terms of their quality of life. They will really benefit from this. Of course, like the surgery, it also has its risk and complications. The aim of a good hospital and a surgeon is to reduce the risk by optimizing the patient. So what do we mean by them? If they are diabetic or hypertensive, we get them checked and we try to reduce the risk and try to optimize their health. Typically, you're in a hospital for 3 to 4 days. You start walking from the next day following surgery, and physiotherapy would be involved the first month or so. It is not unusual for people to get scared about physiotherapy. It's a common notion that people think surgery is done and they just bend our legs, and which is a lot of pain. This is not true. Most of the cases, knee bending comes automatically once it's replaced. But of course, you need a physiotherapy to guide you to, especially in the first few weeks, apprehensive. Can I bend this much? Can I turn this side? All these things will be reassured. So this is about knee replacement. And I'm happy to take any questions from the audience. Thank you. Yeah. So, I mean, until we get questions, I can say that commonly we do for surgery more than 6 years plus. Let's see, we have a question here. My mother is having pain from the back of the hips to the leg. What to do? So, this is a condition where she's complaining of a back pain radiating down the leg. It's not unusual to get back pain, once you cross 60, 65 years. Back pain can be because of multiple reasons. One of them could be because of something called as a disc prolapse, where a disc shock absorbers could come out of the back and they can press on the nerve. Or it could be secondary to arthritis, that is wear and tear in the joint. So basically, in this patient, we have to identify whether it is just a simple back pain, like many of us do get back pain in life, or is there associated nerve entrapment called sciatica. So for which we typically do what is called as a MRI scan of the back, which will help us to identify this. So we have another question about bone density. See, bone density, that's a good question. This is something called as osteoporosis. You might have heard of people, especially women, when they have the menopause, they usually get into this condition called osteoporosis. What it basically means, osteo is bone, porosis means hole in the bone. When you attain menopause, the estrogen, which is normally there, reduces. And this estrogen is the one that locks the calcium in the bone. So when you have this menopause, the estrogen drops down. So there's no more locking mechanism. So there's an increased loss of calcium from your bone. There's a bone loss. So irrespective of the quality of food you eat, that one side. The other side is to prevent bone loss from the calcium loss from the bone. So these patients, especially more than 60, 65 years, if you are a decade post menopause, I would advise you to get something called as a DEXA scan. It's a dual energy X-ray absorptiometer. It's a simple X-ray, which will tell us what is the density of the bone. Now, simple measures like, good sources of calcium, especially for vegetarian. As you know, most of the calcium are good in terms of animal and products, like your cheese, your milk, your poultry, your mutton. For vegetarians, the good sources are green leafy vegetables, your pulses, your soya. Soya is a very good source. So by doing this, keeping yourself active, as I said, for 20 minutes is the best way to increase your calcium organically. But some people who are on certain medicines, especially like hypothyroidism, who are on thyroid medication or on anti-epilepsy medication, that can reduce the calcium. So we need to be, those patients specifically need to be on calcium supplements. Now there is a question, does the knee replacement surgery cause pain in the future due to presence of an artificial knee set up inside? What's the longevity? A good question. The present day knee replacement has come of age. As I told you, we have been started this in 1990 and it's 30 years. A life of a knee replacement typically is between 15 to 20 years. It's because of the rubber I told you between the two implants, which over million cycles undergoes wear and tear. So a life is usually between 15 to 20. So a person who gets this knee replacement after 60 years of age usually will not require another surgery, compared to a person who's getting it in their 40s or early 50s, This, when they get to 70 years, they might need a further surgery, which is about removing this implant and putting another one in. Now, there is no allergy. This is not like a renal transplant. People get confused. Are you putting a knee of someone else into my? This is a mechanical, like a titanium implant that are inside. And you don't have allergies to this. These are biomedically inert stuffs. So there's no risk of rejection or allergic reaction that can happen within what you call as a in other patients where you have a renal transplant or a liver transplant. It doesn't work like that. We just change the alignment of the leg and we put the rubber in between. Now there's a question about, can a 75-year-old man go for knee operation? The oldest person I have operated in terms of a knee replacement is 83 years old. So it's not the number, it's a medical fitness. A 83-year-old who has got a well-controlled diabetic and has had no stroke and no other features of heart failure or other thing is a good patient, because we need two things. We need someone who is anesthetically fit for surgery, and second thing was motivation to do those exercises. These are the two components. So age is not a bar in this. Especially with hip replacement, we have seen people who break their hips mainly due to osteoporosis at the age of 80, 90, and they end up having a half a hip or a full hip replaced. So, so it's not a matter. Now we have this question. My mom has been suggested for a knee replacement. However, she's not willing for that. Is there any other alternative? No, I totally agree. Any surgery, people get apprehensive. It's a natural phenomenon. If someone says, I need a surgery, I'll think 100 times. But the question is, if you can imagine a tire of your car where the thread has gone, okay, now you're driving on the rim, what option do you have? Either you change the tire and then you drive the car, or you park the car in the garage. That is, ask the person to be in the house doing little work. If you expect them to do the normal activity with this tire, it's not going to happen. So a person who is not willing, there are two things. One is fear, which is a very common response to surgery. Or maybe there is some story they have heard about someone in some village got it done and they're not doing so well. See, both have got a truth. In terms of fear, what we can say, we have been doing it on a routinely, as I said, we are on average do 3 to 4 joints a day. It is one of the most successful surgery. If done by the right doctor in the right hospital using the right implant, for the right patient, for the right age. If all these 4 or 5 components are right, the outcome is usually right. Okay, so in spite of it, if a person is not willing for any reason, I would advise for them, most important is weight loss. The study shows even a 10% loss of weight can reduce your chance of having a knee replacement, postpone it by about 5 years. So I think that is one thing you can do. Second thing is physiotherapy, as I told, make sure your muscles are active. Third, there are certain tablets. Obviously, painkillers are not an option because painkillers are not good for your kidney and your stomach lining. So what we can, there are some chondroprotective tablets, we say, like glucosamine, you might have heard of, but even these cannot reverse arthritis. I think paracetamol may be safe at the most, and gels are available, knee braces are available. Steroid injections have been used, but they are only of temporary benefit, maybe for 2 to 3 months. So these are the alternatives that can be done. Now, there is a question, playing badminton for 1 hour daily, will it affect knees? How to protect from injury? See, playing or activity per se will not affect your knee. It's not like your car tire phenomena that if you do more miles, your thread will go. No. It's very important to be involved in some kind of physical activity, and badminton, so be it. But what we need to think about this high impact sports, whether tennis, badminton, squash, is your sudden change of directions. You suddenly move forward, you have to come back. So most important is to keep yourself warmed up before going to the game and do good stretches after the game. I think as long as you do this, you're very well protected. Now there is a question about what are the diagnostic tests to determine the bone muscle health. As I told you earlier, DEXA scan is for the dual energy X-ray absorptiometer. That is for your bone strength. And that is usually preferred for people, as I said, postmenopausal women after 10-15 years. Now, there is a question. After a knee replacement surgery, patient will sit under, can she fully sit down without folding legs? Now, they can, there is no reason why they should not, but we usually recommend them not to do it. The reason being simply the amount of force that goes in the knee when someone is squatting on the leg and when he's going to get up. So, because end of the day, these implants are fixed with the help of a bone cement. How they impact where they go or attached to the bone. So we don't want too much pressure on this. So usually we recommend them to sit even in a low stool, but not to completely sit cross-legged. So that is the answer for that. So any other questions as we speak? So if there is any other questions, I'm more than happy to answer. Otherwise, I think we have covered most of the questions here. Sorry, there is one question about an ankle joint. Let me just see that. What's that? 50? I'm 58 years old. I always had pain in bones, but gradually the problem has multiplied, especially my lower legs, wrist, and knee. So this is a person who's complaining of what is called as a polyarthritis, where you have more than two joints becoming a problem. We call it polyarthritis. In this case, we actually need to rule out certain common conditions called inflammatory arthritis, like rheumatoid arthritis, where there's an issue in the blood itself. It's genetic, that your body, your blood system is fighting against the joint. So there's something called as a rheumatoid factor or inflammatory markers, which can be the cause of this polyarthritis. So it's important you see an orthopod or a rheumatologist to first make sure you don't suffer from one of this. Other thing is post-viral arthritis. People who have chikungunya or dengue can sometimes convert into permanent arthritis. So these are the conditions that needs to be checked. Fibromyalgia is another condition which can affect multiple joints. That would be my recommendation. Next thing, I'm facing an ankle joint problem. Is there any treatment available? Yes, see the ankle joint is the lowest joint in our lower legs. So that takes a whole body weight. Though it's a very small joint compared to a hip or a knee, it takes up the whole body weight. So if you had an injury, a twisting injury, or if you had a scratch in the joint, then there is a chance that you would have damaged the cartilage. So it's important that we see and we address that. Yeah. So usually you see an orthopedic surgeon, you start with an X-ray. Sometime we can do an MRI scan. So there is a question about ligament tear long back. How will it affect after old age? So ligament tear, the commonest ligament we call as an anterior cruciate ligament. It's like a rubber band, which is between the two bones, your femur, your thigh bone, and your leg bone, which holds it together. It acts as a door stopper and prevents your knee from slipping. So if someone had a ligament tear to engage, there'll be risk of what's called the instability. They'll be slipping and they might have caused scratches to the joint. So if that has happened, they can lead to secondary instability related arthritis. So please meet a surgeon and he will be able to help you through. Yeah. Thank you so much. I think that's the end of questions. Thank you. Have a good day.